Hi, this is Daniel DiTuro. Do you have health insurance and still owe thousands in medical bills? In this video, I'll share why have medical insurance, the medical insurance savings myth, surprise billing, the medical insurance maze, appeals and grievance black hole, and prescription drug insurance. People buy insurance to protect against catastrophic losses. Homeowners insurance protects against fire, theft, water damage, wind damage, and liability. Auto insurance protects against liability and collision damage. Life insurance protects against income loss and final expenses. Instead of buying health insurance to cover catastrophic illness expenses like serious injuries, cancer, and heart disease, millions of Americans rely on health insurance to pay for basic health care. Without insurance, a routine physical exam can cost up to $1,000. One primary care physician office visit can cost $300 or more. Uninsured patients are billed the full amount. Insured patients pay negotiated fees that can still add up to thousands of dollars out of pocket. A person with low-cost, high-deductible plans must pay all negotiated fees up to their deductible. Americans are told having health insurance saves them money. In many cases, this is a myth. There's a reason medical providers and insurance companies do not want to publish their fees. The fee for a preventative colonoscopy is about $2,000 with insurance and $800 without insurance. A brain MRI averages $800 with insurance and $275 without insurance. An insurance company's negotiated MRI fee can be $1,000 for its HMO plan and $4,000 for its PPO plan. You may wonder why the same procedure can have such a wide range of negotiated fees. In the U.S., health insurance companies have no incentive to negotiate lower fees or save policyholders money. The next time you see your doctor, listen for the range of office visit copays. In most cases, healthcare providers have no clue what patients are charged for each procedure. Neither do they know how much patients pay for prescription drugs. Drug prices vary by type of insurance coverage and the plan's formulary. If only a free market healthcare system will drive down costs, why aren't providers required to publish their fees? Lawmakers talk about reducing the cost of healthcare at election time and do nothing after they are elected. State and federal lawmakers have no incentive to regulate medical fees and drug prices, since Wealthcare money helps fund their election campaigns. Millions of Americans have HMO health insurance to save money. HMOs only pay for in-network providers. Until January 1st, 2022, Americans were responsible for surprise bills by out-of-network providers. These surprise bills can add up to thousands of dollars. Typically, a person receiving emergency room care received surprise bills. While the hospital emergency room is in-network, some doctors are out-of-network. Out-of-network doctors can demand their full fee, not the insurance plan contracted fee. With a few exceptions, surprise billing was outlawed, effective January 1st, 2022. I've shared how copays and fees differ between medical insurance plans. Before Wealthcare, when you called a doctor, you were asked to describe your symptoms. Today, you're asked about your insurance coverage. Unlike hospital emergency rooms, doctors can refuse to accept uninsured and out-of-network patients. The U.S. spends about $4 trillion a year on healthcare and still has about 30 million uninsured adults. The 2012 Affordable Care Act decreased the number of uninsured Americans, but fell short of providing universal health care. Before the Affordable Care Act, numerous pre-existing conditions denied millions of Americans health insurance coverage at any price. Unlike countries with universal health care, where patients have little or no out-of-pocket expenses, Americans face a bewildering maze of insurance plans. Not only are there a maze of insurance plans, there are a variety of plans within each plan. Even Medicare has become so confusing, Americans are encouraged to call Medicare helplines. Medicare helplines are run by insurance companies offering highly profitable Medicare Advantage plans. As I've shared, insurance is supposed to protect one from catastrophic losses. Selecting health insurance should not be a complex maze of plans with secret negotiated fees. All insurance plans have in-network providers and numeric codes for every procedure. Using in-network providers can mean changing your doctor or doctors. New doctors neither know you nor your medical history, unlike a doctor who has seen you for years. Good luck if there's a billing error. Do not expect your insurance company's customer service to help resolve the error. It is your responsibility to have the provider correct the error. A simple coding error can take months to correct. All insurance plans are required to have procedures for appeals and grievances. There is no guarantee the issue will be resolved. Unless it concerns life and death, insurance companies can ignore appeals and grievances without penalty. Many states have no penalties for ignoring appeals and grievances. For millions of Americans, a major reason for having health insurance is prescription drug coverage. Like healthcare costs in general, prescription drug prices have increased dramatically. For uninsured Americans, it can come down to life or death. Millions of Americans either cannot afford to have their prescriptions filled, or they ration them by taking less than the prescribed dosage. Thanks in part to the American diet and lifestyle, the U.S. consumes about 45% of the world's supply of prescription medications. Thanks to free market Wealthcare, Americans pay the world's highest prices for prescription drugs. For decades, politicians have talked about reducing prescription drug prices and then develop Wealthcare amnesia after they are elected. The pharmaceutical and health products industry spends about $230 million a year on congressional lobbyists. That amount does not include the millions in campaign contributions. There are about 1,600 Wealthcare lobbyists throughout the U.S. financed by your Wealthcare dollars. U.S. Wealthcare has made millions of people very wealthy by delivering mediocre health care for exorbitant fees. Please leave a comment if you have any questions about this video. Thank you for watching.